So we've been discussing distal acupuncture and how to think in terms of three different segments, being the upper arms, the forearms, and then the hands, or the thighs, and the lower legs, and then the feet. And thinking in terms of this allows us a new perspective that corresponds with our traditional theories, but gives us some insights into how things work from a myofascial perspective as well as from a neurological perspective. In imaging, the hands and feet correspond to the head and face. The long bones, either here, or in the femur. The long bones correspond to the spine. We can do the imaging where the most distal portion corresponds to the neck, or we can do reverse imaging where the proximal portion corresponds to the neck. Now, one of the key things, try this for those people that have herniations. Remember that on the superficial back arm line, okay, that it includes the large intestine meridian as well as the Jiao meridian. These two meridians get consolidated on one line, that superficial back arm line. It includes the dorsal part of the hand, and it includes the extensors of the forearm, so those muscles involved in wrist extension, and then it includes the deltoid. Now, there's a lot of points that we can use here. I've mentioned the point combination of Luo Zhen and Jiao 3 and Jiao 5 for neck pain. Now, typically in the traditional systems, we're doing that on the opposite side. I start there on the opposite side, but you will find that some of your clients are actually going to get a better result when you do it on the same side for neck pain and tension, because the trapezius is part of that superficial back arm line, right? So for GB21 pain, you can do Jiao 3 and Luo Zhen with Jiao 5 and get release here. If they've got that elevated trap and it's causing pain, that can help release that very quickly and very effectively. So on the superficial back arm line, we have the extensors, as I mentioned, and then we have the deltoid, and then we have the trapezius. So this is a mechanical and myofascial way to understand why points here are able to treat the neck. Now, if you use these points and let's say it's on an acute condition, you get a good response most of the time. For chronic conditions, you need to do a bit more. You need to get to those deeper lines. So small intestine 3 or 22.08 and 22.09, they're going to be on that deep back arm line, and they get to deeper muscles in the neck, such as the levator scapulae, and the upper back, the rhomboids, the rotator cuff muscles, supraspinatus, and then the infraspinatus as well are all on that line. So if you do these points that are on that superficial back arm line, you're reaching the superficial level in the neck. And for the people with more chronic conditions, you're going to want to make sure that you hit those deeper levels of the myofascia. The other way that we've discussed that you can do that is you can do bone pecking technique on these points just above LI11. So for any sort of bone-related condition that's occurring in the cervical spine and down to T1, T2, maybe even as far as T5, T6, T7, you can apply bone pecking at these 3 points, and they're located 2 cun above LI11, 2 cun, and 2 cun, okay? The bone pecking technique is to do 3 to 5 pecks for 3 to 5 seconds, and then on each of those points, and then wait 10 minutes, do it again, wait another 10 minutes, and then do it again when you take the needles out, okay? So that bone pecking technique is going to be useful for arthritis, stenosis, disc herniations, chronic conditions, okay? Now, I'm typically not doing those right from the first. I will if it's definitely a diagnosed bone condition. However, I may use those later, maybe on the 3rd or 4th treatment, okay?